with our different communication styles, what needs to happen is the written and verbal. If it is not written, according to the state, if anything ended up in court, it never happened. Because other people communicate differently, the verbal is important. Let's not say you have to go to everybody, but what would be an example of there was an incident or a change of doing the verbal? Do you call everybody on the team? No. Who do you call and give that verbal report to?
House manager?
House manager. And the next shift coming on, right? So you have the written and the verbal. You're not only writing it down, but you're telling the next shift when you're doing shift change, and then you're following up and making sure you call the manager. Now what happens after that? The house manager will probably check in for the next couple of days on each shift, see how things are going. They'll come in, they'll check your documentation, and then you've done your job effectively and efficiently, okay?
The medical record is a permanent collection of legal documents that should supply an all-encompassing, accurate report concerning a patient's health condition. Physicians, nurses, social workers, dietitians, mid-level providers, and other members of the interdisciplinary team contribute to each patient's medical record to paint a comprehensive picture of the patient's status along with any care that has been rendered. The patient's charts need to contain enough pertinent data to enable each member of the healthcare team to render care in an integrated manner. Some things you should do in order to make sure that you treat these records as legal documents are: use black ink unless you are using a computer. Do not use pencil or ink that can be erased. Write so that it can be read clearly. There should be no sloppy writing. Date all of your notes. Proper date includes the month, the day, and the year. Write the time that you write your note. Sign your full name and title, CNA, PCA, etc. Do not scribble things out if you make a mistake. Do not use whiteout or any other thing that covers up writing. Write only facts. Do not chart before the fact. For example, do not check off a bath on the flow sheet until the bath is done. Do not use abbreviations unless they are accepted for use by your hospital or nursing home. Do not allow anyone to touch or look at medical records unless they are healthcare providers taking care of that patient or resident. Keep all medical records in a safe and secure place. Medical records are confidential. Do not tell anyone about what is in them unless they are taking care of the person.
Okay, so a couple of things I want to highlight on there, and if you guys have any questions about that. Big one, whiteout. Seen it. Don't use it, okay? Red pen. Should only be used by an RN. Staff never use a red pen. What color do we use? Black or blue. No pencil. Nothing that can be erased. That means even an erasable pen. Okay? And I'm going to give you a big highlight on why no whiteout. Okay? If it does end up in court or something, you want to make sure that you're just writing a line through it, and we'll talk about that later. Okay? It's just important that you understand, especially medical records. MARS. You cannot use whiteout on your MARS. You let management deal with that, okay, and handle that, or we cross a line and we'll show you the proper procedure for all of that, okay? You don't scribble things out. We draw a line. I don't know how many times I've seen that in my 20 plus years. No scribble, 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 or try to scribble over it. And we've all done it. and we've all been there, but we gotta just get out of the habit, okay? The abbreviations we talked about, there are some that are unacceptable, we'll go into more training about that, and some that are. Just make sure you know what abbreviations are okay to use and what abbreviations are not okay. We won't go into that into this training, but we will deal with that in another training.
Documentation also must be done on time. It must be done in a timely manner. It must be done as soon as possible because documentation used to communicate about the patient or resident. It must be ready to see and ready to use for decisions. You should not wait until the end of the shift to do it. It is a very important part of care. Take the time to document and report as often as needed. Documentation should also be professional. Handwriting should be neat and easy to read. Spelling should be correct. Look up the spelling of a word if you do not know how to spell it. Never change what you have written. Electronics records are becoming the standard everywhere. But if you are still writing your notes on paper, never attempt to change a note after it has been written. If you have made a mistake, do not use erasers, do not use correction fluids, and do not cross out a note and write over it. Your institution should have a policy in place that can tell you how to correct a written mistake. Ask your nurse manager or supervisor. Many times it is considered acceptable to cross out the incorrect note with a single line, write mistaken entry, and initial it immediately after the note, and then enter the date, the time, and your initials. All of your documentation in the patient or resident chart must be correct. If a person's temperature was 101.4 at 2:30 p.m., the reading and the time that it was taken must be written in a correct way. You should not write that it was taken at 2 p.m. if it was taken at 2:30 p.m. And you should not write that it was 101 degrees when it was 101.4. You must also write only those things that you actually do see, hear, or feel. You should not write, "The resident is lazy today." This may not be true. You did not see lazy. You thought that person may be lazy, but you did not see or hear lazy. It may not mean that a patient is lazy when you see them sleep most of the day. They could be very ill, or it may be that they did not sleep at all the night before because the other patient in their room was noisy all night. Instead, you should write, "The patient slept from 8 a.m. until 12 noon and was only awake when vital signs were done at 10 a.m. Or, if the person says they are feeling lazy, you should write and report that the patient said, "I am feeling very lazy today."
With quote unquote.